Assalamu alaikum rahmatullah, Bruder und Sister. Ich weiß nicht, was ist besser für euch, Deutsch, Englisch? Wie viele Leute können die Deutsch? Deutsch is okay, or it's better to speak in English? English. Okay, I have prepared my presentation in German, but it's no problem. I will try to translate it directly to English. Firstly, I'll introduce myself. My name is Dr. Murad Ghanem. I'm a cardiologist from Palestine. I came to Luxembourg for 2 years. I was in Germany. And now I have my practice in Schifflange and Lloydlange here in Luxembourg. Firstly, thank you for this chance to talk with my brothers about Ramadan and our health. Therefore, I have here the title with Sicher Fasting für Körper und Seele. That means how we can do Ramadan with our health for our body and soul. In this presentation, we will talk about some facts about Ramadan and some physiological effects on our body through fasting and after iftar. After that, it's important to know some facts to how we can do Ramadan to stay healthy. And there is some diseases, it's very important to concern about it. Through Ramadan, I will talk about diabetes and hypertension. These are the most common diseases we should concern about it through our fasting. As the Sheikh said in the first khutbah, in the Quran, in Surah Al-Baqarah, it is obligatory to fasting Ramadan for all Muslims, but surely, as usual in Islam, our health is the first line. That means if we are on travel or diseased, we can repeat the days after Ramadan, or maybe to be fidya if we couldn't make Ramadan. And now, in this video, I will talk about the physiological changes in our bodies through fasting. And subhanAllah, there is a lot of positive effects on our bodies through Ramadan. And the first one is to reduce weight. Through fasting, through the days, we will reduce weight. It is a good thing through Ramadan. On the other one, we will help to reduce the fat amount in our body, and we will increase the insulin resistance in our body through fasting. And that means we will get our sugar from our muscle, because through fasting we cannot eat the sugar, and we will turn our fat in our bodies through the liver to sugar. And that helps to lose a lot of weight. It will make an effect to reduce the risk of diabetes through the fasting. But the most important thing through fasting is the dehydration. That means we should drink a lot amount of fluids between iftar and suhoor, and it should be 1.5 to 2 liters a day. It is very important to do that daily, and to reduce the amount of coffee, because the coffee it's like fluids, but it works like a diuretic. That means we will lose a lot of fluids through urination. Otherwise, water, we should take a lot of electrolytes. That means potassium, magnesium. If we don't get it through our food, we should take it as substances like multivitamins. But it's very important, for example, in a suhoor, to eat 1 banana. It had a lot of potassium, would help us for our heart to reduce the amount of arrhythmias and the muscle pain. Through fasting, we help our stomach. Through fasting, it's very important, which will reduce the blähung in our tummy. But the most important thing after iftar, the problem, we will eat a lot of foods directly after iftar. It's a failure. We should start slowly at first, like Prophet Muhammad sallallahu alaihi wasallam. Auch our advice to take some water or maybe some dates, tamr. And then after salah, maybe we can start with a little of soup, and after that we take some protein and carbohydrate. The problem to eat all the amount of food directly after iftar, and that will make a lot of reflux and stomach problems. How is the effect of fasting on our cardiovascular, on our heart? through the dehydration, it could make a low blood pressure. Therefore, it's important for the people with hypertension to monitor the blood pressure throughout the day through the fasting. There is a new study, and it helps to reduce the amount of heart infarct or the strokes because of fasting. There was a study because the fasting through the day will increase the good cholesterol in our body and reduce the bad cholesterol. And it was a new study for 2 years that the fasting our immune system will be strong, and that means we will reduce the amount of infection. How can we be healthy through Ramadan? It's important to arrange our time. The Ramadan, it is not only eating and drinking. It's very important to manage our sleeping. And this is maybe the major problem through Ramadan. We should try to sleep minimum 6 to 8 hours a day. It helps us to maintain our power through the day. And it is important to prevent a lot of exercise through the fasting day. But it is to do that after maybe Taraweeh or after Iftar, the sport activities. How is it with food through Ramadan? As I said, for example, in suhoor, it's important to get fluids and some vitamins and also protein through eggs or yogurt. And after Iftar, it's important to start with a little of dates, tamar. It have a lot of vitamins and sugar, and a lot of soup and vitamins. And another time, fluids, and then fluids. It's the important thing through Ramadan. Yeah. We shouldn't ignore the positive effect of fasting also on our psychological effect. The Sheikh they have said in the first khutbah, through our fasting together, through our praying, maybe Taraweeh, through the fasting to feel with the other people, it helps us to the positive thinking for the other people, to donate, to do the good things. There is a lot of studies they have showed that fasting on Ramadan will have a good effect on our psychological status. How is it with exercise through Ramadan? As I said, it's better to reduce the amount of exercise throughout the day, but Taraweeh, it is like an exercise. It's very important to practice it. Or maybe after Taraweeh, it is good to do that 3 to 4 times a week, maybe half an hour walking, fast walking. It's the problem. How is it with the diseases? Should I fast or not? There is a lot of questions from my patients. Should I fast Ramadan or not? It's a little bit difficult to answer. Not all the diabetes patients maybe can fast, but I will see more than 80% they can adapt the disease through Ramadan. But I have said in Quran, the state, I will say it in German or in English. That means when we are diseased, we can stop Ramadan, or maybe we can repeat these days after that. It's important to understand that. Some diseases we cannot do Ramadan properly with a lot of insulin, like diabetic patients. The most important patients or diseases, they are three types: the diabetes, on the heart patients with the heart failure, and the chronic kidney diseases. I think these groups, there is around 10 to 20% from these patients, they couldn't do Ramadan. Also, the pregnant and through the breastfeeding. The medication, there is 2 types of medication. Some of them, we cannot do fasting with this medication, like the fluids medication or the tablets. But the other medication, like creams on the body or something like that, we can make it through Ramadan. I don't know how is it with the inhalation therapy. Maybe the Sheikh will explain it if it's halal or not. But I think it's
okay.
It's okay
if it's just something that is it diminishes until it goes down. So if it
it is important for the asthma patient to do the inhalation maybe 2 times a day. Yeah. Therefore, it is. I'll explain this one. And I will talk a little bit about 2 types of patients: the diabetic and the hypertension. The first type of disease is diabetes. It is very important to manage the diabetes throughout Ramadan. And the first thing, maybe it is a little bit too late, but you should visit your doctor 2 to 3 weeks before Ramadan to manage the amount of insulin. It is important to increase the amount of long insulin and reduce the amount of fast insulin. I don't know if there's some patients with insulin here, but it's very important to visit the doctor and to see that you would like to do Ramadan. And that means the diabetes insulin, we should adjust it before Ramadan. We will increase the long time insulin, for example, is the Lantus, and we will do it after iftar or not after suhoor, and we will reduce the amount of fast insulin. But the patients with the diabetes, with only tablets, they can do Ramadan as usual. There is no problem, there is no risk of low blood sugar in the blood. The two problems with diabetes, they could have through the fasting a very low level of sugar or a very high level of sugar. And there is two values, below than 70 milligram per deciliter or more than 300. This type of patient, they shouldn't do Ramadan. It is very important to manage the blood sugar 2 hours before the suhoor, 2 hours after iftar, and minimum 2 times through the fasting. And if you had a very low blood sugar under 70 or a very high blood sugar, that means it's a criteria to stop fasting. And therefore, there are 3 categories of diabetes. The last one, the green one, it is the normal diabetes with the oral tablets. They can do Ramadan without any problem. They can manage the tablets on the suhoor and iftar. The high risk patients, type 1 diabetes. This type 1, that means the patients need insulin. And I think this type of patients, they cannot do Ramadan. It's very, very difficult to manage the blood pressure. They will have a lot of low sugar level through fasting. And there is the between of them, the patient, they take medication and they take insulin, they have another risk factors like blood pressure or other problems. This group, they should ask their doctor before Ramadan to manage the medication. I have said the blood sugar test through fasting. And it's also very important to manage our food, or the diabetes patient to manage the food throughout the fasting. After iftar, they should increase the amount of vitamins and protein and less amount of sugar. And as I said, when should the diabetic stop the fasting? If the blood sugar level between or less than 70 or more than 300. And the symptoms of the low blood pressure, it will be like dizziness, sweaty, or loss of consciousness. Or if it's a very high blood sugar, he will have a lot of thirsty feeling, he will go a lot to the toilet, he lose a lot of fluids, and therefore these symptoms, you should test your sugar, and if it is more than these values, you should stop the fasting at this day. The other disease is the hypertension, the high blood pressure. This group of patients, it is a little bit easier than the diabetes. Normally, the hypertension patients, they have the medication once or 2 times a day. Therefore, we can manage it also the same in the normal days, in suhoor and after iftar. But the most important thing, some patients, for my patients, they take some diuretica. Diuretica, that means like thiazide or Lasix or something like this medication. I will change it after iftar, not after suhoor. If you had this medication, it's better to move it after iftar, because if you get it after suhoor directly, you will lose a lot of water through the day. It's important to move it after iftar. It's also the same like diabetes. You should manage your blood pressure 2 hours before suhoor or after suhoor and 2 hours after iftar. The important criteria for the hypertension, you should stop also Ramadan if you had a lot of headache or breast pain. Therefore, you should manage your blood pressure. It shouldn't be more than 180 to 120. Or in Luxembourg, we said 18 to 12. If it's more than this value, you should stop Ramadan. It is a very risk to have some bleedings on your brain. Therefore, you should stop it and take your medication. The other problem is the low blood pressure. I have a lot of patients through the Ramadan, they will have a low blood pressure, not a very high blood pressure, because they are dehydrated, there's not a lot of fluids, and they will have a lot of dizziness. Therefore, it's very important to manage the blood pressure and to visit the doctor to maybe to adjust the therapy. And also here there are three groups for the blood pressure patients that are very high risk with the organ problems, with the kidney failure or heart failure. These patients, it's a little bit difficult maybe to make all over the Ramadan. Maybe it's better to stop Ramadan for this group. The other group, there is no problem. You can manage your blood pressure without any problem. As I have said, we can move the medication, the long-standing blood pressure medication, they are acting for 24 hours. That means there is no problem if you take it after iftar or after suhoor. The only point, only to move the diuretic therapy after iftar or not after suhoor. How is it with the food? For the hypertension patient, it's important to reduce the amount of salt, not more than a small spoon of salt. Because it is a very important part that will increase your blood pressure. You shouldn't increase the salt in your food in Ramadan all over the time for the hypertension. Another time, it's very important to increase the amount of water from 1.5 to 2 liters a day. We shouldn't forget the training. Ramadan, we should do a little bit sport. One of them, Taraweeh, it is a good exercise. It's a very good one for our soul, but also for our bodies. Through the half an hour, and maybe we can increase it another half an hour after Taraweeh with a little bit walking or some training. When should I stop fasting? I have said when the blood pressure more than 180 to 110, on the symptoms, a severe headache or a severe breast pain. The last message from me for the patients, that means in our religion, alhamdulillah, that our health is the first line. That means if through the fasting we couldn't do that because of some diseases, we can stop that. We have another chances to do Ramadan after that repeat the days after Ramadan, or maybe to be some fidya. It's important to visit your doctor maybe 1 week before Ramadan if you had a chronic diseases like diabetes or hypertension. The most important thing, to make a regular control for your blood test if you are a diabetic, and the blood pressure minimum 3 times a day, before the suhoor, after iftar, and through the day. And it's very important to know which line or which is the criteria which you couldn't make the Ramadan after that. For the blood sugar, I have said more than 300 or less than 70, and for the blood pressure, 180 to 110. With these values, you couldn't make the Ramadan, and you should stop and eat or take your medication again, or visit your doctor. Okay. And thank you very much. And Assalamu alaikum wa rahmatullah. It's a little bit maybe difficult in English, but I have tried to do that. Und Ramadan Kareem, inshallah, lil-Jami'. Und habt ihr Fragen? Or do you have any question?
There are questions. If you want, I can make a short in Bosnian.
Yeah.
A short translation, then we can go to the questions. Bismillahirrahmanirrahim. Kratko ćemo raditi prijevod okvirnih stvari, dakle ja svakako ne mogu ovim detaljima pričati, nego generalno o smjernicama koje je doktor kazao, pa ćemo onda prijeći inšallah na pitanje. U suštini, dakle, ono o čemu je doktor govorio jeste da su nekoliko koristi od posta koji su pitanje tjelesne, to je kada je pitanju, dakle, fizički osjetno, ono što je da ćemo smanjiti svoju tjelesnu težinu, smanjit ćemo udio masti u svom tijelu, procent masti i šećera u svom tijelu. Stvar na koju treba paziti je svakako dehidracija tokom posta, dakle da se pije dovoljna količina vode, odnosno veća količina nego inače. Dakle, minimalno 2 litra, kako je kazao doktor, kako bismo izbjegli tu opasnost dehidracije, jer veliki dio dana radimo, funkcionišemo, a ne uzimamo nikakvu tekućinu ili tečnost u sebe. Također kaže da pojačamo konzumiranje elektrolita, dakle magnezijuma, kalcijuma i tih stvari kroz razne vrste, znači unošenja, ja mislim da ste upoznati s tim, dakle, mimo hrane i pića, kako se to može, tablete koje se mogu uzimati pri tome. Također, kada dođemo do pitanja jela, odnosno iftara i sahura, da se jede polako i postepeno. I u suštini ovo je stvar gdje se dotičemo opet sa vjerskim dijelom. Dakle, poslanik sallallahu alejhi ve sellem kako je jeo je kada ogladni, a kada jede, ne jede da se najede, da se prejede, nego čisto, kako je kazao, dovoljno čovjeku hrane da drži kičmu uspravno. Dakle, da se jede u nekoj razumnoj mjeri, ili kako je to rečeno, trećina za hranu, trećina za tečnost i trećina za zrak, tako da u suštini čovjek ako bi se toga držao, da ne legne odmah poslije jedenja, da ne jede, da ne pije stojeći, da ne jede ležeći, poslanik sallallahu je rekao ja ne jedem naslanjan, i tako dalje. Čovjek ako praktikuje sunnet, onda će svakako dobrim dijelom preventivno djelovati na mnoge ove stvari. Jačamo svoj imunni sistem i smanjujemo mogućnost bilo kakvih infekcija i upala. S tim da treba obratiti pažnju također na spavanje u Ramazanu, što je, kao što smo malo prije rekli, dosta poremećeno u Ramazanu. Noći se definitivno manje spava, tako da bi trebalo pokušati dan nadoknaditi, tako da kaže doktor minimum nekih 6, a optimalno 8 sati dnevno. Također, kada je u pitanju vježbanje i fizička aktivnost, trebalo bi to raditi poslije teravije ako već. Dakle, bilo bi lijepo, kaže doktor, da svakako imamo 3 do 4 puta sedmično neku veću fizičku aktivnost, ali po mogućnosti da to ne radimo u toku posta. Intenzivnija aktivnost nego nakon iftara, odnosno nakon teravije, na primjer brzi hod i tome slično. Kod sahura i iftara treba obratiti na nekoliko stvari. Kod sahura da se dovoljno tečnosti popije i da se unesu vitamini i proteini, dakle te kroz voće i tako dalje, i proteini kroz, na primjer, jaja i jogurt i tako dalje. A kod, dakle, iftara, kao što smo rekli, posebno polako jedenje, dakle, počinjanje sa datolama, sa supom, sa dosta tečnosti, kako čovjek, kako bi uzeo ono što će mu najviše koristiti u tom trenutku tijelu, a vidjet ćemo da je to i sunnet poslanika sallallahu alejhi ve sellem, jer on bi počeo, dakle, prekidanje posta, odnosno iftar sa datulama, pa vodom, i onda bi klanjao i onda bi krenuo sa, dakle, pravim jelom iftarom, tako da. Pored tih tjelesnih efekata svakako imamo taj psihološki efekat da samo to stanje fizičko, a i stanje duhovno utiče na naše psihološko stanje, da smo mnogo stabilniji, pa je i to jedna od koristi koja se također može medicinski potvrditi. Sad, kada su u pitanju bolesti, svakako da čovjek tu treba da bude u konsultaciji sa svojim doktorom, sa svojim ljekarom, da ne prepušta stvari ako već ima određenu bolest koju tretira, koju se liječi, određene medikamente koje koristi na redovnoj bazi, da bude u kontaktu sa ljekarom, kako da postupa vezano za Ramazan. Jer u suštini u svim ovim poznatim hroničnim oboljenjima imaju kategorije male rizičnosti, srednje i visoke rizičnosti. Oni male rizičnosti, dakle oni medikamentima mogu da medikamente i terapiju prilagode, da kažemo, načinu posta i jedenja i raspored tih stvari u toku dana i nije nikakav problem. Srednja rizičnost u svim ovim oboljenjima koje je doktor spominjao, dakle tu treba vidjeti sa ljekarom može li se adekvatno naći da li alternativa u medikamentima, da li neki drugi raspored, u svakom slučaju da se to vidi sa njim, jer može se lako doći u situaciju da čovjek ne može isposti te dane bez neke štete. A visoka rizičnost, takvi ljudi, takvi bolesnici ne bi trebali postiti, jer kao što smo rekli ranije, kad smo govorili ko nije dužan postiti, onaj koji je u teškoj bolesti, koji je u stanju, kome će mu post naškoditi, on ne treba da posti. I to ne važi samo za nekoga koji je bolesnik u osnovi, nego važi i za putnika, jer mi smo kazali da čovjek koji je putnik nije dužan da posti. Sad ima pod pitanje, dobro, šta je bolje? Šta je bolje raditi? Ne moraš postiti, ali možeš. A šta je bolje? Kažu učenjaci, ako će ti put i tvoje zdravstveno stanje tokom puta zbog posta biti znatno lošije, da će se napatiti, bolje ti je da ne postiš, bolje ti je da jedeš. Jer je poslanik alejhi salatu vesselam jednog puta naišao na grupu ljudi koji se okupili oko jednoga koji je pao u nesvijest. I onda su ga poljevali vodom i tako dalje, kaže šta je s ovim, kažu posti. Kaže, lejse min al-birri as-sawmu fi safar, nije dobročinstvo da čovjek posti tokom putovanja. To je za onoga kome šeti. A onome ko nema nikakvog problema, lagano, evo, kao na primjer mnoga naša putovanja, pogotovo kraće relacije, a koje su ipak putovanje, čovjek može sasvim normalno da to izdrži, tada je bolje da posti. Tada mu je bolje da posti, jer je poslanik sallallahu alejhi ve sellem također u nekim pohodima, dakle, bio među rijetkima koji su postili na najvećih željama. Tako da je doktor spominjao dijabetičare, spominjao je bolesnike kada su sa visokim ili niskim pritiskom i u suštini svodi se na ono što smo rekli sad kada smo podijelili, dakle, na te tri vrste rizičnosti, da svak onaj tu bolest, da li je šećer, da li je pitanje pritiska koji tretira medikamentima koji može rasporediti prema iftaru i sahuru, može to uraditi bez problema da posti. Ko je ima već specifičnu terapiju neku, ono obavezno treba da vidi se lekarom šta da radi, da ne bi došao u situaciju da dovodi svoje zdravlje u pitanje. Također, jedna od stvari koje je bitno isto bilo spomenuti, da ljudi koji imaju pogotovo bolesti sa organima, hroničnu bolest nekih organa koji su ključni, kao što su bubrezi, kao što je jetra i tako dalje, oni bi trebali prije Ramazana na 2-3 dana da naprave termin kod ljekara i da vide kako im je stanje. Kako im je stanje i šta da radi sa ovim Ramazanom koji dolazi, da ne puštaju tako slučaju, da tako kažem. Također za šećeraše, da mjerimo, ja nisam hvala šećeraše da mjeri, 2 sata poslije sahura, jednom tokom posta i 2 sata poslije iftara svoje stanje šećera, kako ne bi to otišlo van kontrole, da čovjek ne osjeti na vrijeme. Eto, toliko je bilo u suštini oko ovih glavnih poruka doktora, a o ovim detaljima može svakako pitanje postaviti.